What's up, guys? So, something we want to talk about in our video log series number 2 is a common question we get is, well, should I go see a surgeon before I come to see you? Or should I go see a PCP before I come to see you? And not that I can give any definitive answers, and this is a very loaded question for a lot of people because there's a lot of things going on typically. However, a vast majority of the time, for athletes that are dealing with simple aches and pains or something that's been going on for a long time that isn't causing you any significant increases in pain on the day-to-day and you can still live your daily life, typically the answer is going to be no. Now, sometimes there's some extreme issues or things going on that might need, advanced medical treatment or pharmacological or surgical intervention right away. But typically that's not the case. So with that being said, there's a few parts of this answer, which one is, the first part is the misunderstanding. So as we practice in Massachusetts, we are a direct access state. That means you don't need to go to a primary care physician, you don't need to go see a surgeon, and you can come right to a physical therapist or a chiropractor or anything like that, any medical professional. Now, sometimes your insurance won't always cover that. Sometimes the insurance requires you to go to the doctor first, but because a lot of these companies are realizing too that it's more cost effective to do physical therapy over going to see a surgeon or a PCP, a lot of these companies are now allowing people just to go directly to a physical therapist. And now where we do take insurance as well as cash or direct pay, however you want to pay, we take a direct payment, you can come right here. And there's benefit to that in multiple ways. So for one, instead of going to a primary care whose real job is to rule out red flags, they're a general practitioner, they're not a specialist in any certain area, they're not a cardiologist, they're not a neurologist, right? They're there to realize that something is wrong in a certain organ system or some type of, functional system of the body and refer you out to the proper person, whether that be the emergency room or an orthopedic surgeon or a neurologist, a dermatologist, anything like that. Now, a lot of times what's going to happen is that PCP you go to isn't going to know what's wrong, and they're going to end up sending you to something like an orthopedic surgeon or a neurologist or something like that if they think there might be a nerve-related injury. Now, a lot of the time you'll go, so you had one eval already, now you're going to go get a second evaluation from an orthopedist who many a times is going to tell you to go see a physical therapist. So you just wasted, quite a few hours and some money to go see those people when you're still going to come to the physical therapist and we're going to reach our own functional diagnosis. So again, that part of the question of should I go see the surgeon first or the PCP first, my answer is going to be no for the most part. And if you were to call me and tell me some certain symptoms you were experiencing or anything like that, I might have a different answer for you. However, and this is the big difference of surgery versus physical therapy, or the surgeon versus the physical therapist, is kind of this structural sphere they work in versus this functional sphere we work in. And so I had this conversation with a patient the other day. Now this patient came in, they had some shoulder pain and some things that weren't really moving so well that we wanted to improve the function of. And we looked upstream and we looked at the neck and the thoracic spine, and we noticed some things that were also going wrong there that could be causing the shoulder pain. So we were actually able to clear some of those symptoms up within his first visit. He got better. He came back, he's still feeling better. And then he is an athlete, and they decided, well, I want to go see a surgeon just to make sure. And the thing is that surgeon might see something in there, right? So the big thing we see in the field now, and what we found over the last 10 years or so, is biomechanics and function don't always correlate to pain. So the fact of the matter is, over 50% of the population has something like a herniated disc, a torn meniscus, torn rotator cuff muscles, tendinopathy, things like that, that experience zero pain, zero dysfunction. They don't even know it's there until we do an MRI. So the problem becomes, if the patient, get an MRI and we see that we have, oh, there is a labral tear. That's why I have pain. That's not why you have pain. The reason you have pain could be something about the function of what's moving around that. So in this case, this kid had shoulder pain. However, his thoracic spine wasn't moving well, his neck wasn't moving well. So what happens? This just ends up taking a brunt of the force and feels overworked and starts to feel pain. As soon as we clear the function up here and up here in the neck, everything starts to improve itself. So that labral tear might be a part of the issue. However, it likely isn't. And that's in the fact that we have to raise the question of, well, if 50% of the population have these types of things and the other half don't, then what are we doing, right? My case with this is sometimes surgical intervention is needed, sometimes hands-on treatment is needed, sometimes it's not, sometimes it's self-care, sometimes it's better training. There's all kinds of different answers. Now, the other issue is this piece of avoidance. So a lot of the times you go to a surgeon or the PCP and it's, well, I have knee pain with squatting and this and that. And maybe we do a scan and it's, well, yeah, you have a torn meniscus, you need to stop squatting. Well, that doesn't always make sense, because typically when we load something progressively and appropriately, those things can get better with conservative management. And a lot of the research shows they get better with conservative physical therapy management than they ever did with surgery. So the other piece of that is, yes, there might be a torn meniscus, but again, is it a problem with the meniscus that is causing the knee pain? Or is it a problem with the squat? Is there something going on? Did we have pain beforehand that changed the motor pattern, that changed the way we squat, that put too much excessive load in one area that we could offset with varying exercise? Or maybe we're just missing exercises. I see a lot of powerlifters on a daily basis that come in with knee pain and none of them can stand on one leg because none of them are doing single leg work. Well, we should probably be able to stand on one leg before we try to squat heavy weight with two legs. And the thing is, these are things surgeons, PCPs, other medical practitioners aren't looking at and aren't doing. They're strictly looking at structure. We're going to come in and look at function. So it doesn't always matter what the inside of the joint looks like. It's a piece of the puzzle, but it's not the whole thing. And I think that's where a lot of people go wrong by going to a surgeon and being told, I have a herniated disc, no wonder I have nerve pain. Well, a lot of times we can do different things that's going to take that pain right away through offloading different positions, changing positions, doing other things. Really what happens is the nerve gets sensitive because it feels threatened. It's not because the nerve is impinged. You don't, and that's why pain can change throughout the day too. So a lot of people do have herniated discs in their back or sciatica or whatever you want to call it. And the thing with that is you can feel more pain in the morning or more pain at night, less pain in the morning, whatever the case may be, whatever the common pain trend is for that person. Typically, there's some type of pattern where pain isn't there all day. Now, that doesn't mean that that disc is sliding in and out or herniating against that nerve all day, right? That just doesn't make sense. That pain is going to be there, for some reason or not, but it's not always physical. And that's the mindset I want to try to get people out of, is that I have this pain because of this mechanical piece that's wrong with me. Typically it's not. Typically there's a workaround or work through to get you back to what you were doing without ever needing to go to a surgeon or anything like that. So if you guys have questions, feel free to reach out, Brett at barbelltherapyperformance.com, or check out our website, barbelltherapyperformance.com. Hope this helps you guys, and thanks for watching.